When I recently floated the idea that bypass surgery is safer than angioplasty and stenting, that is PCI, people couldn't believe me. And people were somewhat shocked that this could be the case. Now, let's look at the idea of angioplasty and stenting. The modern day term for this is PCI, percutaneous coronary intervention. The coronary arteries comes from the base of the aorta, the largest artery in our body. In order to get into the coronary arteries, interventional cardiologists have to introduce guide wires, stents, and other implements and devices in order to get to the area of interest, that is the narrow coronary artery. So all these devices have to pass from the inserting port, which is usually at the wrist but can be from the groin. Then these have to be introduced through the aorta up to the top and then into the coronary arteries. So they have to get a long way through the aorta in order to be introduced into the coronary arteries. There's no escaping this. Unfortunately, many patients who come for treatment for their heart disease are not 100% healthy. That is, if you look carefully now, all the arteries in the body, including the aorta, may well be diseased in any case. So there's a real danger when introducing substances and instruments into the aorta that damage can occur. And the main concern here is loosening the thickening or the atherosclerotic material within the aorta, which may then follow the flow of blood to cause blockage, especially in the brain arteries, resulting in strokes. Now, the risk of stroke or clinically evident stroke following coronary angioplasty and stenting is quite low, but recent studies from a Japanese group have shown that the incidence of so-called silent stroke is actually quite high. Silent stroke means that using magnetic resonance imaging, a very sensitive way to look at the damage to the brain following routine cardiac catheterization. So when Japanese investigators look at this phenomenon, the incidence of silent stroke following cardiac catheterization is as high as 32%. The risk is increased in patients who are older, which carries a higher atherosclerotic burden. So the PCI, angioplasty and stenting, is not really 100% harmless. There is associated risks, especially with stroke. These adds up. The more complex the situation is, the higher the risk. And also, the more times it is done, the overall risk increases. I've said before that a lot of patients require repeated procedures because of further blockage or restenosis of the treated coronary arteries. So these have not only financial implications, but also the overall increased risk associated with the procedure. So this will be longer term risk, but we are talking about the shorter term, that is the procedure related complications from the treatment. Then you can argue that surgery, when done conventionally, also carries this risk. Conventionally, when we do coronary artery bypass surgery, we open the chest through the sternum, sternotomy, and then we'll cannulate the aorta and also the heart in order to use the heart lung machine while we stop the heart temporarily during the coronary artery bypass procedure. So inevitably there will be manipulation of the aorta for cannulation. In addition, when we do it conventionally, we would need to attach the top ends of the additional graft, either vein or artery, to the aorta. And this usually entails side clamping a part of the wall of the aorta in order to do the anastomosis. So all these can contribute to side effects, including strokes, from loosening the material inside the aorta. So the newer concept of off-pump without surgery do not require us to cannulate the aorta or use a heart lung machine. But in a conventional way, where this is done through a median sternotomy with multiple bypasses, we still need to attach the top end of the vein grafts or the arterial graft to the aorta, which involve manipulation of the aorta. A new concept of minimally invasive coronary artery bypass grafting obviates the need to touch the aorta. So in this minimally invasive procedure, a small cut is made on the patient's left chest through which both internal mammary arteries are harvested, and with clever manipulation and configuration of the anastomosis, we can bypass all surfaces, all areas of the heart without needing to touch the aorta, either for cardiopulmonary bypass, that is using the heart lung machine, or attaching any top ends to the aorta. So with these, the risk of the surgery is much reduced and the recovery is much faster, much more comfortable for the patients, and the longer the results will be much better. It is this idea of minimally invasive coronary artery bypass grafting off pump without median sternotomy which I feel has superior advantage over conventional PCI or angioplasty and stenting, because with this new procedure we do not have to touch the aorta whatsoever. So I believe that this is the best option for people with severe coronary artery disease requiring treatment, rather than going for angioplasty and stenting PCI repeatedly.